Hello everyone, today we discuss a very important topic. It's insulin management in diabetes. So it's endocrine, insulin, and diabetes is something very important. A lot of patients have this problem and we need to know how to fix it. So we have two types of diabetes. We have type 1 and we have type 2. Type 1, usually the average is 0.2 unit per kilogram. Type 2, usually 0.4 units per kilogram. Okay, so this is average. Let's say for 100 kilogram individual. Then in this case, let's say for type 1, it's 50 units. For type 2, it's around 40 units. Okay, this total daily dose, and then what you do half of that is gonna be basal, half of that it's gonna be bolus. So let's say in this situation, basal, let's say 20, bolus is gonna be 20 for this 100 kilogram individual. Okay, so what is the glucose? So this is the glucose. This is how it usually is. This, like, let's say, okay, so this is the glucose. This is time. Okay, so normal glucose usually, let's say around 100. Okay, and then this is what in the morning when you wake up, and then when you eat your breakfast, it goes up to 240, let's say, and then comes down. That's in normal people. It does not go above 140. Sorry, here is the 140. Okay, and then this for lunch is going to go up to 140 and come down. For dinner, same thing, goes up to 140 and come down. And then if it goes up between 140 and 200, this is called pre-diabetes. If it goes up more than 200, okay, then this is the diabetes. This is the definition of diabetes. So it's actually reversible. It's just a number diagnosis. So for these people, usually, having that said, usually, let's say you give them 20 units in the morning. Okay, let's say it's Levemir, okay, or Lantus, any of the long-acting, and then basal boluses, usually you give them before the meal. Okay, let's say 20 divided by 3 meals, and you give them 7 units here, 7 units here, and 7 units here. Okay, so here's the problem. What if the glucose is not under control despite all these things? So the way you can calculate the individual carbs for that specific patients, usually let's say this is the number is going to be, let's say 500, okay, divided by the total daily dose of insulin. Okay, so let's say it's 500. Let's say the total daily dose is 50. Okay, so in this situation, this 0 takes 0, this is going to be 10. So this case, 10 carbs, here's the number. For every 10 carbs, you give them 1 unit. Okay, so what you do, you tell the patient, teach them, go download the apps called MyFitnessPal or Fitbit, okay, to calculate your calories and tells you the carbohydrates. For every 10 carbohydrates, you give 1 unit. So this is going to be individualized, and it's better in managing diabetes. Okay, you can add extra units. So let's say the carbohydrates, let's say you ate 20, you add 20 units. Okay, so that's the way, ideally we need blood glucose be controlled with this approach. So you can add extra. Let's say you add 1 unit here, you add 2 units here. So because you cannot just tell the patient, okay, take 7 units every 3 times a day. What if they don't eat here? They don't need to take insulin. In this case, you're going to increase the risk of hypoglycemia. So what if the patient eats 3 times a day, and despite all of that, his blood glucose still not controlled? In this case, we can add something that's called correction dose. Okay, correction dose. Ideally, you want this to be working. Okay, if that didn't work, then this is kind of a backup plan. This is a proactive. This is reactive. So it's better to be proactive. rather than reactive. Correction dose, the way you calculate it, you have 1500 divided by the total daily dose. Okay, so in this case, 1500 divided by 50. Okay, it's going to 0, take 0, and then 5, 3 is going to be 30. Here, 3, 15, now it's 3, 30. Okay, so it's going to be 30 glucose. So what that means, for every 30 gram of glucose above 140, you give 1 unit. Okay, so let's say this patient have a glucose of 200 here after eating, after they have their insulin and then they ate, and there's still the glucose is 200 2 hours after eating. So what would you do in this case? So 200, how much is above 140? By 60. Okay, so it's by 60 above 140. 140 is the normal. It's 60 extra. So if it's below 140, it's okay. If it's more than 140, that's a problem. So if it's 60, in this case, how many units do we give? 60 grams. If 60 grams, for every 30 gram, we give 1 unit. If there are 60 grams, then in this case, we give 2 extra units. And this way you can keep glucose under 140. So it's very important to teach your patient how to manage their blood glucose, because they are the one that eat and they're the one that control their insulin, and it takes a lot of time. Usually patients spend 1 to 2 hours just managing their diabetes. It's a very hard task. So it's very important that they become educated about their glucose and their diabetes and the importance of controlling blood glucose below 140. So the most important 2 numbers that you want to look in diabetes, you want to look at the morning glucose. Morning glucose dictate the basal. So if this one is high, the basal is still high, let's say 200, then in this case, you increase the basal by 2 units. You add extra 2 units. Okay? If the bullous, the one 2 hours after meal or 2 hours after dinner, okay, let's say, if it's around 200, then you add 2 units to the nighttime insulin. Okay, you add extra 2 units. So this is the way how you control diabetes, like by just kind of adjusting insulin based on what they eat and based on their blood sugar reading. That's why it's very important for the patient to check a blood sugar at least twice, one in the morning and one 2 hours after meal. Okay, so that's kind of a summary of how to manage insulin in diabetic patients.